It is life-changing. This is life-changing. It's amazing.
The cost of living is very high in Hawaii. It's very high in many parts of the country, but especially so in Hawaii. And we have a fairly acute shortage of healthcare professionals in the state. And it's very challenging, especially for young people if they've got educational loans, they're trying to pay rent, trying to pay gas, trying to pay food. And to try and save, for example, for a down payment on a house, it's very challenging if they're paying off student loans, which many people have.
I am in pediatric endocrinology.
I'm a surgeon. I'm a behavioral health coordinator at the Rise Youth Service and Empowerment Shelter in Kailua, Hawaii.
Providing a home, providing for my kids, and then paying off an enormous debt is extremely difficult. And you know, there are places on the mainland that offer a low cost of living and then high wages and also loan forgiveness in addition. And they try to recruit people to those places.
Sometimes I'd be paying $1,500 a month for just the loans, just to try to make some kind of nick, even though, you know, when you're up past $90,000, that doesn't really make a nick at all.
Over the course of my training, I accumulated additional debt because of interest rates, which remain high.
So we came up with this idea, working with the governor and the legislature, to get some state money to pay off these student loans. So these are student loans for people who have debt related to their education or their training in healthcare.
Usually people are about 30 years old when they finish their training and they would like to get started, maybe buy a house, but they also have what's tantamount to a mortgage with this $300,000, $400,000, $500,000 in some cases debt. So by eliminating the debt picture for healthcare providers, it helps them to be able to afford a home, set down their roots, and then stay here. They can't do both. And that's why without this program, we have this kind of revolving door of doctors and nurses coming in and out.
It alleviates my stress, my financial stress, my emotional stress, because debt itself causes burdens to families, causes burdens to a person. And I do have a big family, so it does alleviate a lot of stress.
I've always kept telling my husband, it's time to leave the island. Okay, it's time to leave the island. But there's always something that I get these blessings along the way that says, no, you gotta stay.
I'm able to take less time, you know, in the office and spread it out in the community. And this will allow me to stay here and continue to take care of the people of Hawaii. Because, you know, in order to pay my loans off without the program, I probably eventually would have had to go to the mainland where there are opportunities for me to get loan repayment.
In year one, we had $10 million to appropriate. We did 485 health scholars into the HELP program. In year two, we'll have $20 million. We'll carry over that first cohort and add another, I believe, about 600 healthcare providers. And then in perpetuity, we should always have that kind of number. About 1,000 people in the program, and we have thousands of shortages, but we quickly get there with this kind of program.
HELP is important because it's going to enable Hawaii to hopefully build a more permanent solution to their healthcare needs. There's not enough clinicians in the state today to deliver the type of care that is needed in the state, and travelers are an expensive solution and unsustainable in healthcare systems around the country. HELP is an investment that the state is making to make sure that they can attract clinicians to be in the state of Hawaii long term, and in turn reduce costs of labor and bring people that are truly going to give world-class care to the patients.
I do encourage a lot of my healthcare partners that come like, hey, did you hear about the HELP?
What do you have to lose? You know what I mean? And I'm glad I did, because it's just like I hit a jackpot. I think the hardest part is going and getting your account number for your student loans and seeing the amount of money you owe.
Applicants should know that this is a great program to commit to Hawaii and repay your loans without any other strings attached. Just commit and know that you're going to be here at least 2 years, and we will forgive a big hunk of your medical loans.
The loan repayment program has granted me $50,000 a year for 2 years. So $100,000 total going towards my debt, which won't completely eliminate it because it is so large, but it will help to a great degree. hope?
Validating.
A blessing. It's a blessing.